Kania kan long ka khubor ka ban ai man siam ki babon ki brio ki bala shong kurim ki badan ka jing shitam makamed bat ki bamla aban yo khon wala ki le shong kurim la bon snem Kawainik Hospital jeng kiriu shimet ke badan hakani kenong ba shlong hakani ka kenti ke la Plie ka Tnad ke Sumar Kyrpang ya kum kita kisijur ki bamla aban yo khon ya ke bala Plie pat ba hakalai pauterik benai leber menta ke snem ar hajar ar puar Ka Bethany Hospital Shillong hakani ka sngi ka la Plie pat ba ka jaka Sumar ke bala tip ka Center for Reproductive Medicine ka jaka Sumar rengkat ki kor ki borjing start medical science ka jok ke bamenta ban Sumar Kyrpang ki kentai bat sinrang ki bamla yo khon wala ke le shong kurim na bon snem yakni ka jaka Sumar jong ka Bethany Hospital Shillong hakni ka sngi la Plie pat ba da ka secretary jong ka sarkar jela ka bakmi ya ka Tnad ka kya ikong Rosetta M Kurba ibala long ka kongsan hakni ka jingelang rengkat ka jingedan lang ka deputy commissioner ka district East Khasi Hills ikong Isa Wanda lalu kum ka sembut kongsan bat ka jingedan lang ka director jong ka Bethany Hospital Shillong ka Achula di Silo
I really congratulate the hospital administration for coming up with the center to help our people to overcome this gap. It is indeed a gap for the state of Meghalaya, where, as we have said, that our people need to go outside of the state. And in this present situation, where we fear to travel, where we are still uncertain whether, going out is the right step to take. So people have been prolonging, to take this very important step in their life. So I really thank the administration here in Bethany Hospital to have come up with this concept and to come up with this center. And I would only wish that, this center would be a center of hope.
As we know, in the past 2 years, a spotlight had been thrown on the high number of maternal and newborn deaths in the state during the COVID-19 pandemic. Allow me to dwell a little bit on this. Even as efforts are being made to ensure the availability of essential public health services to the last mile, the state health policy has been launched. We also recognize that there are other very important factors in the context of Meghalaya that need to be addressed in tandem. Amongst them are social factors, the strength of community participation, poverty and other economic factors, deeply entrenched beliefs and faith-based convictions that deeply impact the response to public health interventions. In the context of rural East Khasi Hills in particular, our district is constantly grappling with high fertility rates, with low birth spacing, with poor take-up of family planning initiatives, which oftentimes has very adverse maternal and neonatal outcomes. The consequences of this are often heartbreaking. We have a maternal death review which is chaired by the district magistrate, and recently we encountered a case of a 49-year-old woman who died of pregnancy-related complications. She was in her 16th gravida. 16 children at the age of 49, she died, leaving behind a large and very young family. So these are issues which we constantly come across with on a daily basis, and hence we recognize the need for conjoined efforts, for a wider discourse, and for a destigmatization of issues pertaining to women's health, which is urgently required so that we do away with the number of children or families who have to bear the loss of a mother because of otherwise easily preventable maternal and pregnancy-related issues.
Hababatay pencai kandiat halor kene ke jaka Sumar u Dr. Ubakli ke Center for Reproductive Medicine u Dr. Batiston Wanba ulithu bakadaw hi ke baki kentai kimla banyo khon wat lak la shong kurim bon snem ha ki babun ki khep hi kadai namar ke jing shongkha ondala he arta palan nrei don pat haba kidang dei karta ban shong kurim bat kidang biang karta kadaw pat kadai ni kijat met ke badan lala ki jong ki jing stom
Te kani ka Center for Reproductive Medicine kadai ya kita ki syukurim ki bampatla ban armet lani ya ki syukurim ki bala armet tangba ki don bakila hab lani ki yo miscarriage ki khamla ban yo I khlung ngi hangni hapo ka Center for Reproductive Medicine ha Bethany Hospital ngin ai ka jing Sumar ya ki syukurim hakum katkum karukom ka jing don kam jongki kajing Sumar kam long tang ba barok ki haban le ya kata ka IVF kumba ki ngitip barok haj menta tang ba ngila ban ai ki jing Sumar ki ba pher la ki jong ki levels Idon hadu lai level ke level beningkong baar berbalai. Hakata kerukom daladep kendo bat ladep le ki test beron kam ikidi sikurim ngisasla ban shim ka rai ya ka ek bhatam ya kita ki sikurim bakin haban le. Ti ki treatment ki long ki bapher nganchu kren ha ki lai kerdan kita ki treatment mo kata ka level 1 ka bangi le level 1 ngi ai tang di ki dawai kuli bat ki penon kam ya ka ultrasound ru ban yarap ya ki armut sikurim bakin smotho ka por ka bakongsan ya ki bakin haban shong khnang bakila ban yo ka jingjob bakin armet.
Kajing Sumar hakane kejaka ha Bethany Hospital Shillong kan omdai tang iki kenthai. Henry on Sumar ki shinrang ru kumjo. Haba batai halor kajing shimpor ban Sumar laong ba ka baslem do kan dai lai benai. Bat kajing lut ka ba he do kan long kumba shilak shiteng kat kum ki jat rukom Sumar.
Brio. Kaniru ka shimpor hi shibnai ne shibnai steng hadu bangin tip ba kila armet ne kimpar armet but kaniru ka success rate ka long kumba 90% ye. Ka jinglut kan pher ne iwei nongpang kat kum ka jingdon kam ki inject jongki but kat kum ka reta jongki. Nadu ba ngala sedang practice hang ne hajela nadu upnai December arjar arpho ngala persyang ban collect kini ki data tang bangam tip kat no kin long accurate number bang collect petang nak ke jaka ka bang syong ngayo ka data ka balong hadu khatsau khatsan persen ye bakidon ki couples ki bamla ban armet hadu menta but ladang ipet bon nikini ki couples ki dei bakila kio pelat kata kerta jong ka kenthai brio kala tam ne ka lai pusan bat ka lai prasnem ngakham yar ban yo ya ki couples ki bakham duna ka age bakin don kam ki jing Sumar ki bahe kadon ka ka data ru ka bangala pet but ngalap ba nakashispa angut saupho kindei wetang thik ka jingthut nakaliang jong ka kenthai brio saupho kindei thik ka jingthut nakaliang jong shinrang brio but kumba shipho nakita ka shispa kin long ka jingthut jong bro arngut ka kenthai but shinrang but shipho nakata kindei ka jingthut ka bamdon hakenu kanu ka liang ru ka shudei ba kila persyang sau sansnem kila persyang hiru ki dawai ki dashin kila shim but kim par laban armet ka bangi khot haktin pareng ka unexplained nani ka bamdon daw balei ba kim laban armet.